Welcome to the Breakthrough Broadcast, a podcast about innovative STEM solutions to real-world problems. From emerging technologies to practical research, Drew Reck explores how science, engineering, and bold thinking are shaping the future.
Hi, I'm Drew, and this episode is about PCMs, or phase change materials, and how they can solve the issue of vaccine transportation. There's a big problem that during the transportation process, vaccines fail, and they become unable to provide immunity to the eventual patient. And this isn't usually because of bad science or improper manufacturing. Most vaccines fail because of heat during the transportation process. This temperature slowly damages the biological components inside vaccines. And the big issue with this is that vaccine damage is invisible. The vial looks completely normal, except that when it reaches the patient, it no longer performs its purpose. A damaged vaccine no longer triggers immunity. The cold chain is the system that keeps vaccines at their proper temperature from factory all the way to patient. The cold chain keeps vaccines between 2 and 8 degrees Celsius at all times, because if it strays from this region, it will no longer be functional. A single break anywhere in the cold chain can permanently damage a dose. And cooling the vaccine again doesn't reverse the damage. Any singular spot where it's not quite where it needs to be can ruin it forever. The issue is, keeping the cold chain functional requires the assumption of constant access to refrigeration and electricity. And this electricity is the weak link. Refrigeration requires this electricity or fuel in some way. But power outages are common in many regions, and generators require fuel, maintenance, and trained staff. These resources are really not always available. Fuel shortages and breakdowns are frequent, and even short outages can warm vaccines well beyond safe limits. This makes traditional refrigeration very, very unreliable in many settings. The biggest issue here is that the last mile problem. Vaccines will almost always survive the international transport process successfully. The most dangerous stage is the final delivery to clinics and individuals. This is because this isn't a standardized process. The last mile isn't nearly as standardized as the hours-long flight across the world. This means the safety regulations are harder to enforce. And since transport can often involve motorcycles, boats, or walking, it's really hard to keep a refrigerator and have electricity available to those motorcycle drivers or walkers. Refrigeration often stops entirely during this phase, and since outdoor temperatures can be extreme, they often ruin vaccines. One, and the initial solution to this problem, was just freezing vaccines beforehand so that as they warm, they won't get too warm for the vaccine to fail. However, there is a bottom limit to how cold vaccines can be. Ice crystals can damage proteins and viruses inside vaccines, tearing apart the very delicate protein structure. This creates a very narrow safe temperature window, again, at 2 to 8 degrees Celsius. Now, the focus is more on precision rather than just maximum cooling. Another solution is monitoring and changing, although this is not very effective. Temperature sensors only detect damage after the fact. They don't prevent temperature spikes, and many clinics lack real-time monitoring or people to perform this. Data is often checked too late, and prevention is far more effective than just this detection. This would also require lots of resources in human capital and money, making it unreasonable. So, the next solution is making it an engineering question rather than a different type of one. The traditional approach is to build more refrigerators. The problem is that this costs a lot of money, it uses tons of electricity, it requires maintenance, and is not exceptionally reliable. Again, all of these are problems that we've already failed from, so it's unreasonable to assume that this will be successful. So the new question we pose is, can containers that might not need electricity regulate temperature themselves? This makes it a materials-focused question rather than one just based on machines. These passive solutions can require on material science and rely on that material science instead of using electricity and machinery. The idea of passive cooling is the answer to this question. Passive cooling works without electricity, There's no motors, compressors, or software. The system responds automatically to heat. This system has fewer parts, which means fewer failures, which means overall, the cold chain is more successful. This is still reliable in difficult environments, when people don't have resources, or when maintenance falls off an edge. And this example of passive cooling that we were discussing is phase change materials, or PCMs. A phase change material changes state at a very specific temperature. In this case, phase means solid or liquid or even gas. And for vaccine storage, PCMs are designed to melt near 5 degrees. Things that work for this situation are waxes, salts, and specific fatty acids. What they do is they seal these materials inside containers. And what happens is when heat gets to the container, the heat energy, is absorbed by this phase change material, this PCM, and it's turned into a change in phase, a change in from solid to liquid or from liquid to gas even. This additional heat energy makes the molecules and the atoms inside these materials vibrate more. And that is the energy that is no longer given to our vaccines, heating them up. This energy is called latent heat. And being able to utilize latent heat without ruining vaccines is the core of PCM technology and its application in vaccine transportation. To make this a little more intuitive, the idea of latent heat is kind of the way that ice can keep drinks cold. Despite a warm environment, that energy isn't warming the glass. The glass is staying at a consistent cold temperature because of the ice. Instead, the ice is melting, making it so you no longer have ice in the container, but it's still warm. Even while that ice is melting, the temperature of the liquid stays near 0 degrees or maybe slightly higher. PCMs use the same physics of a cool drink. What's important is that these PCMs must be designed very specifically to be within a vaccine-safe range. The material must be non-toxic and stable. It must survive many melt-freeze cycles in case the system is unreliable, and it needs to be durable and consistent. The most important here is that the melting point should be tuned to match a vaccine-safe range. If the melting point is too high, the vaccines will warm, and at that point they will all be ruined before PCM can regulate the temperature. If it's too low, the opposite issue will happen. They'll freeze before the PCM can work. Practically, you can think of it like this. A container starts cold, and inside it, there is another container of some phase change material. As the outside temperature rises, there's heat that flows into the container. But instead of having the container warm up, the PCM begins to melt, instead of warming the vaccines. The issue is that once the PCM is fully melted, it can no longer absorb latent heat. Temperature will begin to rise, and this will ruin the vaccines. Therefore, there's some safe time window, some limit to how effective the PCM can be. As more and more heat comes in and the PCM melts, it no longer has the ability to absorb any heat, making it no longer effective. Fortunately, when the container cools again, the PCM can release this stored heat, converting itself back from liquid to solid. The cooling capacity is restored and the system resets automatically. This is very similar to the idea of an ice pack, although ice melts at 0 degrees, which would be too low, not in the 2 to 8 degree range. PCMs would melt at controlled temperatures and be much more consistent than ice. But knowing that phase changes absorb heat is only the starting point. Engineers don't find the perfect PCM. They have to design it very intentionally. The challenge is to turn this physics principle into a reliable material that can achieve the goal. This is a material science problem, not a thermodynamics problem. Every property of this theoretical PCM has to be engineered, not assumed or found. The first step in this engineering process is choosing the right class of materials. Common PCM families include paraffin waxes, salt hydrates, and fatty acids. Each of these material families has a different melting behavior and heat capacity. Paraffin waxes are stable and cheap, but have lower heat density, meaning that they can't absorb as much heat before melting. Salt hydrides store more heat, but can be chemically unstable and potentially dangerous. No material is perfect, and trade-offs are unavoidable. But it's important to choose which trade-offs and which downsides you can avoid or mitigate, which is why choosing the right class of material is very important. However, these raw materials that you might get rarely melt at the exact needed temperature. Engineers have to adjust the composition of the material to tune the melting point to exactly where they need it to be. This process often happens by mixing multiple materials together to engineer the perfect little aspects of the material. Small changes in the composition can be shift melting temperatures by several full degrees. But for vaccines, even a 1% error can be unacceptable. This requires repeated lab testing and refinement, meaning that this engineering process and this materials design process is very, very difficult. Some materials melt gradually over a range of temperatures, and others will melt sharply at a single temperature. Engineers, especially in this situation, prefer a very sharp phase transition. This is another materials property that has to be engineered and selected for very specifically. Sharp transition keeps temperature more stable, allowing for increased vaccine safety. Broad melting ranges or a slow transition reduce effectiveness and might lead to more temperature change even during the melting process. This time it takes to melt is based on the crystal structure of the material. The most important part of designing a material is its maximizing its latent heat storage. Again, this latent heat is the energy that the material is absorbing to melt, rather than having that energy be turned into heat and absorbed by the vaccines, ruining them. Engineers prefer a sharp phase transition that will keep the temperature more stable, even during the melting process, making it so that the vaccines won't heat up even while the PCM is still melting. A broader range would do the opposite, reduce effectiveness of the PCM, and lead to more temperature variation. The most important part of designing and choosing material is maximizing the latent heat storage. Latent heat determines how much and how long the PCM can absorb heat. Engineers want materials that store large amounts of energy per kilogram, large amounts of latent heat. This is measured using the same technology that determines how many calories are in a piece of food, since this latent heat is just energy, just like calories inside food are just energy. Materials with low latent heat are rejected, and high latent heat is selected, extending safe storage time by up to days. Some PCMs separate into layers after they're melted repeatedly. Others slowly degrade. Engineers test materials over hundreds of cycles to determine what kind of melting they want and what materials will do that kind of melting. They look for changes in melting point, ensuring that a consistent melting point means that the vaccines are consistently protected. Long-term stability is non-negotiable. And unfortunately, this is where many candidate materials fall, because over hundreds or even dozens of melts, their melting point changes, becoming inconsistent and potentially becoming dangerous. One big issue is that PCMs become liquid after they're used. Liquid materials inside a vaccine storage system cannot be allowed to flow freely. You must physically contain the PCM, and this introduces mechanical and materials challenges. The PCM has to stay in place while absorbing heat, meaning that you need some sort of system inside containers. This, unfortunately, is not infrastructure that many people have access to immediately. So that will have to be designed and spread. A big challenge. One major solution is simple encapsulation, where PCMs are just sealed inside plastic shells. Sometimes, each tiny droplet is individually encapsulated, making sure that it is controlled well. These shells prevent leakage and contamination, and they also improve durability and handling. Although it can't be all put together, this encapsulation cannot just be a box, because if so, the consistency of the melting and the latent heat absorption would be poor. Many PCMs are poor thermal conductors. Heat may move too slowly through material, meaning that it takes a long time for it to melt. Again, we want a sharp transition from solid to liquid, meaning a more consistent energy and more consistent temperature inside the container. Engineers add conductive fillers like graphite or metal particles inside the PCM to make it so that energy transfers throughout the material, again, creating that sharp change from solid to liquid. This helps heat spread evenly and solves problems. However, lots of times, too much graphite or too much of these metal particles can be added. This can reduce latent heat and make it less effective at ultimately maintaining a stable temperature. Another challenge is in integrating PCMs into real containers. They can't just be dumped in randomly. Their placement must be carefully decided. They need to be arranged to surround the vaccine chamber evenly. This can prevent hot spots or cold spots. The geometry and the distribution and the thickness of the PCM matters. This is the intentional design, not just packaging or slamming a container into the side of a box. Unfortunately, there's no real similar thing to this. So this design, this energy packing conundrum, is very unique, and the only way to test it is by actually testing it. There's no other ideas to base these designs on. That's why testing is such a big thing. PCMs are heavily tested in controlled lab environments first. Then they're tested under simulated transport conditions. Temperature cycles, vibration, and rough handling are included, and engineers measure how long safe temperatures are maintained. Designs are refined repeatedly based on these failures, and ultimately, PCMs are chosen, designed, and may be deployed. Unfortunately, this isn't a global phenomenon or something that's widely used. These materials are not yet manufacturable at scale. While rare and expensive compounds are avoided, this is still an expensive process. Encapsulation methods must be mass-producible. Cost per container matters greatly for global deployment. And materials science has to meet economics to create the perfect PCM to effectively encapsulate vaccines and keep them safe while keeping prices low. Ultimately, the final engineered solution would be a carefully tuned material with a precise melting point that can take in a high amount of latent heat and is stable over hundreds and hundreds of uses. It's encapsulated well to prevent leakage, and it's integrated in a container well, designed around thermal physics, and spread across the world. This is a materials science success story. It doesn't rely on electronics, it doesn't require user intervention, and it works automatically because of the structure. This is designed at the molecular level, and is incredibly valuable for the future of materials science and the future of vaccine distribution.
Thanks for tuning in to the Breakthrough broadcast. If today's conversation sparked a new idea, share the episode and follow the show wherever you listen. Got a question, idea, or breakthrough of your own? Reach out at breakthroughbroadcastconnect@gmail.com. Until next time, keep questioning, keep building, and don't wait for the future. Help create it.